My name is Professor Hussain Baksh Kolachi. I am Professor of Community Medicine and teaching and working in Isra University. Before that, I was working in Liaquat University of Health Sciences as well as in Dow University of Medical and Health Sciences. I am Fellow of College of Physicians Surgeon of Pakistan. And today I will discuss with you people the new variant Omicron or Omicron or Omicron. These are the words used for this. This is a Greek letter, and the actual scientific name is B.1.1529 is the scientific name of this virus. And this virus was first, not virus, but variant was first identified in the South Africa, most probably in some other countries also by the last week of November. And this is almost 1 week that WHO has declared this variant as a variant of concern. And so far, about 16 countries this variant is reported, and in Europe 42 cases are there, and in South Africa over 100 cases are admitted. Only one is on ventilators, and the cases in UK, USA and other countries are also reported. So this virus is a fast spreading virus and may take over the Delta virus, which is the dominant variant of the COVID-19 in Europe and other countries. The important thing is that the symptomatology of this virus is little bit different than the original COVID virus, because oxygen saturation is not a predominant. Lowering of the oxygen saturation in the patient is not one of the predominant symptom which was in the old symptom, and change or the smell and taste was reduced or almost disturbed in the patient, but here the patient smell and taste remains intact. Another important point is the mutation of this virus, as detected by the sequencing of the virus, shows that almost 30 plus mutations are identified in the S2 receptor region or spike protein, which we call RBD, receptor binding domain, through which the virus actually enters into the cell of the human being and then hijacks the machinery, and replication or multiplication of this virus starts. It is a fact that in one human being, about 1 billion copies of the virus can be produced easily by this virus. So from this you can understand that if in 182 countries this virus is there, and in one person if the number of the viruses is about billion, then you can understand that what will be the number of viruses in the whole world so far. Though it is invisible and we are not able to see, but it is a very dangerous situation. In European countries particularly, about 46 countries, almost 40 countries ICUs were already packed, and the admission rate and infection rate was on the rise. So this picture shows that this virus in the next few months might be a very great problem, and a new pandemic can be reintroduced in the whole world. But the good sign is that at least two doctors, Dr. Mubin, which is a famous doctor of Pakistan but based in the USA, is hopeful that this virus may be more infectious but it may not be so serious, and it may, if the mutation increases, then may disturb the form or the morphology of the virus, and virus may end at some point of the time. So that is another scenario. Dr. John Campbell, on the other hand, was a little bit disturbed that this virus is still a variant of serious concern, but now his opinion says that there is a good news that the symptoms so far in the patients, as I mentioned that in South Africa, the patients, one patient is on ventilator out of 100, and other patients are little bit in a stable condition, and the vaccinated people, they are not hospitalized, not seriously diseases, and those who are not vaccinated are the target of this virus. So still vaccines can work, and virus can be contained at a very early stage. So the options are the SOPs, in which mask is mandatory, and WHO study shows that 53% of the COVID infection can be stopped even by the mass use of the mask. Then is the soap, at least 30-second hand washing is important, and many times you can wash your hands, and this practice should be at mass level, and even in hospitals, healthcare facilities, hand washing is another tool, because this can completely denature the virus. And there is a property, and this is a hygienic measure. So already soap is available in every house. So only we have to create the awareness. Then the overcrowding, social distancing, ventilation, exposure to the sunlight, as well as exercise and good nutrition. I always recommend five five colored vegetables and five colored fruits in Pakistan, so that your nutrition and immunity is boosted. You must get vaccinated if you are not vaccinated, and also reduce the hesitancy. This is one reason that in the whole world 42% population is vaccinated, but in Africa only 6 to 7%, 6.6% exactly is vaccinated. So till we vaccinated the whole Africa, this problem of mutation and COVID pandemic will re-emerge again. With this, I think I will advise to the listeners that COVID is reducing, is decreasing in all over the world, but new variants are coming again and again. So SOPs, vaccination, social distance, mask, as well as awareness, best immunity, and other public health measures, and government and community cooperation is must. We are just giving you this information from Dr. Hussain Bakhsh Kolachi YouTube channel, and we recommend for new information that we provide to the local people in Sindhi as well as in English and other local languages, so that we can reach out to the poor people, illiterate people in a simple way, and can introduce and reinforce the messages of health in the Pakistan as well as in our neighboring countries who understand or who are linked in the Pakistani borders or who share the common borders. At the end, I think the efforts of government Pakistan, NCOC, and my university, ISRA University, is also running a vaccination center with the cooperation of government of Sindh. So I think vaccination in Pakistan it was about 1 million per day, 1 million doses, but now it is reduced about 4 lakh people or half million. So I will request that this should be the point which we should take, and I will request to the Israel students and other students that they should carry this message to the masses. So far 475 cases were reported in last 24 hours, and out of this about 300 cases were in the Sindh province and 144 cases were in other provinces. The recovered cases were 327 and there were 10 deaths in the last 24 hours. Once again, Dr. Hussain Bash Kolachi YouTube channel will give you the latest and update scientific information. Thank you very much.